Which of the following is the most likely causative organism of the patient's initial gastrointestinal illness? All right, so we're dealing with a bug or of some kind of pathogen. 25-year-old man presents the clinical 1 week history of asymmetric joint pain and swelling involving knees and ankles. Reports having a gastrointestinal illness with diarrhea 3 weeks ago, resolved on its own. On exam, conjunctivitis, oral ulcers, lab test revealed elevated ESR and C-reactive um, protein levels, which are the following likely causative organism of gastrointestinal illness. All right, so he is having GI issues that also now extend into joint pain involving knees and ankles. So this is a taro bacterium that is um, affecting knees and ankles as well. But there's let's see, conjunctivitis, oral ulcer, and then he has lab test showing inflammation. 25-year-old. What bug would cause you to have diarrhea, but also joint pain? Um, it's not on its own. So it's not C. diff. C. diff usually comes after infection and use of antibiotics. I don't think
Okay.
it's C. diff. E. coli, inflammation, not sure about E. coli, salmonella. Mm, salmonella can cause osteomyelitis, but osteomyelitis is not a joint issue. It's more of a long bone issue. Let's take that one out. Um, I don't know the diagnosis for this. Oh, Helicobacter pylori, E. coli, and Campylobacter jejuni. Um, I don't really know where to go from here. This is probably gonna be a guess from me now.
Okay. Which one do you want to go with? So
Um,
practically you had an inciting event, right, with diarrhea, and then you have arthritis, you have, conjunctivitis, so issues with your eyes, and then some ulcers in the mouth.
mhm. I'm gonna go H. pylori.
Okay, final answer.
Yeah, but I don't know what
Okay, it's
else.
actually going to be Campylobacter. So let's work through this together. So C. diff, like you said, right, going to be some kind of history of antibiotic use. Um, a lot of diarrhea, but not really so much, arthritis and things like that. E. coli, right? E. coli can give you bloody diarrhea, can give you watery diarrhea, depending on what it is.
Mhm.
But usually not going to give you arthritis or things like that. But it can give you something like HUS, right, which is platelet destruction, petechiae, blood in the urine, but not too much arthritis and things like that. H. pylori, right? That's really going to give you stomach or duodenal ulcers, right? Reflux that doesn't really get better, right? So not really here. It can give you also like a maltoma, also, right, which is a lymphoma of the stomach, right? H. pylori,
Mm.
salmonella, right? Like you said, it can increase your risk of osteomyelitis, especially for sickle cell people. That's usually kind of be the incidence for increase, and it can give you bloody diarrhea. But the main thing is going to be campylobacter here, right? So you're going to have what they call sterile inflammation arthritis. And the reason why it's Campylobacter jejunum, the way I remember it, is that Campylobacter jejunum is highly reactive. Your body is highly reactive to this bug because what other autoimmune issue can come from Campylobacter jejuni that you can remember?
I don't know.
So it can trigger Guillain-Barré syndrome, right? Guillain-Barré, sorry, I couldn't
Oh,
say it for a second.
Guillain-Barré. Okay.
Yeah. So you can have Campylobacter, and then all of a sudden start having neurologic weakness starting from the bottom going up, and it's just because Campylobacter jejuni, the way I remember, is just like very very it's very triggering to your immune system, and so your immune system start accidentally not only fight off the Campylobacter
Right.
jejunum, but also fights your body too. So it can cause nerve issues, and obviously this is like reactive arthritis. So your antibodies are now attacking your joints too, right? Which is why you have elevated ESR and CRP, right? And then when you have reactive arthritis, you can get conjunctivitis with that too. The ulcers can be caused by any kind of stress, so oral ulcers, that is. And one of the key things is they probably threw in oral ulcers here too, is to distract you, because remember, H. pylori can give you stomach and duodenal ulcers, not really oral ulcers.